welcome to another Mark Bishop show. Well, you know, with everything that's been going on with the COVID-19, all sorts of questions are bobbing up. One of them being how to safely re-enter the workforce during this pandemic. And that's a question that we are all asking. So my special guest for this episode is Rhonda Medows, MD, CEO of Ayin Health Solutions, an expert on how tools help employees stay healthy in the workplace. Welcome, Rhonda.
Thank you very much for inviting me.
You're welcome. Well, the COVID-19 pandemic has forever changed the landscape of health and safety in America. Limited testing capability, extreme infection rates, and an ill-equipped workforce have created major hurdles to our way of life and economic prosperity. And as we begin to re-enter the workforce, health status continues to be the ongoing concern. Now, why is up-to-date testing for COVID-19 and antibody testing essential to re-entering the workforce overall?
Well, both the employers and the employees want to be safe and remain healthy. So what we would like to do is to do a couple of things in addition to the testing. This is all part of actually doing the prevention work to keep them healthy and then the detection so that if they are ill, we know early and can intervene early. The testing for active infection and then the testing for antibodies, and we all know that the antibody tests are in different stages of evolution. When these things are combined with actually getting a medical history, checking someone's body temp and their symptoms on a daily basis, when they are combined is when we are best equipped to anticipate and to intervene when people need it. The testing is part of what needs to be done. And of course, I know that there are challenges with getting tests in some places and getting results. That's why we need to do everything for the employee assessment.
So tell us about what is COVID Ready and how it works.
COVID Ready is an end-to-end service that we developed that is basically in response to the coronavirus pandemic specifically. But we kind of incorporate in all the things that we know about public health, pandemic, and healthcare. We start with three basic ideas and bodies of work. One focuses on the prevention, making sure that everybody understands very clearly basic things like hand washing, wearing masks, and social distancing. We then also incorporate and make it really easy for the employer to make available to the employee COVID testing, both for infection and for the antibody. We have the employer subscribe to the service. The employee can go online and register, find out where a local test site is, get the test done, go online, look at the results, and get all of the patient health information that they may need. If the test is negative, fantastic. If the test is positive, how do they access care? What do they do to treat themselves? And how do we get them back healthy as soon as possible?
Well, Rhonda, beyond testing for the virus, what are the key elements that an employer should have in place before reopening their workplace?
Probably about three basic things. One is depending on the business that they are running, what the workplace looks like is really important. The manufacturing plant, can they space out their employees enough to maintain that social distancing space of 6 to 10 feet? If it's a smaller restaurant type setting, then maybe they need to figure out a way to have one-way entry and exit, people picking up food instead of sitting in the restaurant space, those kinds of things. So the first thing is that the employer has to figure out what physical space do they have to manage. The second is figuring out what their employee population is at risk for. If they have a very diverse population, some healthy and young and some maybe not as young, with some chronic conditions they may or may not know about, then they have to figure out who really needs to be back and who can work in alternative ways, maybe phasing in, maybe shifts, maybe using different locations for older employees.
So,
and then finally, the part that we provide is all the services to help them do the end-to-end.
Right. Okay. Yeah, that's sort of what I was alluding to. But how does workplace safety continue beyond the walls of the workplace itself?
So all the things that we do in terms of education on prevention, all the testing, all of the healthcare access to care managers and telehealth extends whether they're in work 9 to 5 or whether they are at home in the evenings with their family. Should they become ill in the off hours, then they can actually get their testing arranged for. If they are ill, test positive, their families then will know also to get tested. All the things that we are teaching and providing during the workday apply to us in general in life, before and after work.
So how can employees then and employers use this type of service?
The employers actually go online and subscribe through Ayin for the COVID Ready service.
Hmm.
And then once they have subscribed, their employees are then automatically listed and they can enroll online. Once they enroll online, they're again directed to testing, to health professionals, to test sites, to care managers, to telehealth, anything that they might need. This is an ongoing service, so whether their test is positive or negative, the service is still available for them throughout the remainder of the pandemic itself. We use a lot of things like wearables on site to help with their screening for temperature and symptoms, so they can even actually figure that out before they even go to work in the morning.
Hmm.
And so if they're ill and need to have a test done, we can arrange it offline ahead of time before they return.
Well, Rhonda, will employees participate voluntarily or will they be required to participate if their employer implements this service?
We as a company don't make people or mandate people use it. We encourage the employer to get the engagement and participation of their employees. That's a discussion between the two. Obviously, it kind of makes sense. The more people who are complying and doing the work of prevention, detection, and then getting care, the better off we'll all be, right?
Mm.
This is public health. So that means that anything that one person experiences can be spread and shared with others.
While we're on that part, what's the web address again that people can actually read about now themselves? www what?
www.ayin, that's spelled AYIN.com.
Okay.
That's where they can actually see the COVID Ready information.
Okay. Now, in this new reality, for the want of another word, employers need services and tools to integrate screening measures, symptom assessment, and workplace monitoring and healthcare coordination. I guess, Rhonda, that regular, frequent public health and testing updates do help, stakeholders remain up to date with this rapidly evolving and unprecedented public health emergency.
It does, and it's hard sometimes because the updates occur sometimes several times within a day, never mind weekly. But we consider that our work. The company COVID Ready, that's our responsibility as healthcare experts and as population health leaders to make sure that we keep up to speed on behalf of the employer and the employee population. That's one less thing that they have to worry about. They keep up with what the science is on the test, what the new treatments are, what the protocols are they're recommended for public health screening and for contact tracing. That's our job, and that makes it easier for the employer.
Well, I guess to that, in this unprecedented environment, both employers and employees, they're eager to foster a healthy workplace and keep lines of communication open regarding health and safety practices, you would think.
I think that's really true. The employees are also parts of our community, and they have family members. They all want to remain healthy. They don't want to bring anything home to their families, to their loved ones, and they don't want anything from their loved ones necessarily to impact their coworkers. This is all about thinking beyond the individual and thinking about everybody you come in contact with, especially in the workplace.
Well, new technology, it's not only designed to, supplement employer return to work strategies, but also to support ongoing worksite strategies as the current health situation continues to evolve. Rhonda, it's been great speaking with you, and thank you for the effort coming out with Ayin Health Solutions. This is a pretty good deal. And people can read about it again at AYIN, so it's www, that is, .ayin.com. That's the website, pretty simple. And you can read all about Ayin Health Solutions. And we've been talking with Dr. Rhonda Medows, who is the Chief Executive Officer of Ayin Health Solutions. Rhonda, thanks again. Or Doctor, thank you so much.
Thank you very much. Be well.
And you too. Stay safe.